Hi, welcome to Pharmacy Pulse. I'm your host, Tom Matchett, Managing Director of PharmaDigital, and this week our very special guest is none other than Mr. Mike Bereza, who is the Clinical Director of PharmaDoctor. Welcome to the show, Mike. Great to have you here.
Thank you, Tom.
And this week's special is going to be looking at GPhC exam preparation. Mike,
Hello.
you're something of an expert on this.
I wouldn't say an expert, but I've had a lot of experience. I mean, I've been through the exam myself and I've tutored quite a few pre-registration students. So I wouldn't say I know 100% what I'm talking about, but I have a bit of background in the area.
Well, I think that maybe we could kick off this week then with you sharing with us, first of all, your insights into what is the most important part of the exam.
Well, I think there's just so many aspects to it now, and it's evolved so much over the past few years. I think really at the moment it's looking at the kind of clinical side of it. In the past, the exam was deemed quite easy. Almost 90% of all students who went through the exam passed, but the pass rate now has dropped down to around about 70%. So it's quite a big drop. And I think the real reason for that is just they're trying to make the exam a lot harder. And the way they're doing that, I think, is the clinical aspect of it. I mean, a few years ago, there was a question about laminar flow and things you'd never really expect to see in a pre-registration exam. So really, yeah, the clinical side, if I was going to put it straight.
When did you train for your pre-registration exam?
2006, so that's what, 7-8 years ago.
And do you think that you would have passed today's examination with what you knew then?
To be honest, no.
And there we have it, the truth.
Exclusive.
The truth. And could you share with us, so for the new exam now, how long do you have to train for it?
Well, traditionally, the amount of time you have allocated for training is around about 9 months. Mm-hmm. But I tend to tell my students, don't pick up and go full steam before December. So really relax at the beginning, get accustomed to the pharmacy environment, and then around about January, then start doing loads of questions, reading the books, and doing as much as possible for you to succeed. Interesting.
And I know, I'm sure there are many of our viewers that are watching today that would really love to hear from you. What are your top tips for the exam?
I think firstly, don't worry. Yeah, I think a lot of people are hearing about this drop from 90% to 70% pass rate. I think, there's still the majority of people pass this exam, 70%. The 30% that fail, I think really just aren't prepared at all whatsoever, and they haven't got adequate resources. So they're not going on tutor training days, they're not going on websites and accessing the as many questions as possible, they're not going to the GPhC website and downloading all of the papers. I think if you have a regimented training plan and you stick to it, you'll definitely be in that 70%.
Is there any available template for a regimented training plan?
There is. I mean, we've made some on the PharmacyCPA.com website, and it's in our book as well. But as I said, the schedule I probably stick to is don't worry till December, get through Christmas, have a nice little holiday, get into January, and then really kind of pick up on it. I think going through the BNF is super important. I think going through the MEP, although it's not included in the resources anymore, it's a very good thing to learn about schedules of controlled drugs and all the different legality parts. They're saying now that pharmacy students should go on to legislation.org or .gov.uk and look at it there. But I think the MEP is a really good resource which kind of summarises everything. And then really using practice, and that's what the GPhC are really trying to figure out with pre-registration students. Like, if you become a pharmacist, will you be safe? Will you be, will there be this guarantee of quality of your advice to that patient? So I think when you're there as a pre-registration student talking to patients, think, how can I do this to best practice? How can I learn from this? How can I do my competency statements to reflect that I'm picking up knowledge from my practice?
Well, as ever, of course, clinical excellence is always such a key part of any training in the world of pharmacy.
And medicine.
Oh yeah, absolutely. And I know that you've mentioned some of the online resources, including, for example, PharmacyCPA.com and some of the others that are available. But could you maybe just give us a brief summation of maybe the top 5 must-use and must-know resources online for GPhC pre-reg examinations?
That's a good question, Tom. I'd say that, so primarily I'd go to the GPhC website. So they have registration.org or something like pharmacyregulation.org. I think that as kind of the cornerstone, because that's where all the pre-registration tutor documents and the student documents come from. Obviously, I would also go for the pharmacy forum, which is really, really popular, and lots of students go up there and lots of pharmacists go and they talk and they send out questions and things. The PharmacyCPA website, I've been making that for the past decade almost, since I graduated.
How many users, so if you don't mind me interrupting, how many users do you have on that annually?
Well, annually we have around 600 to 700, and there are about 2,000 pre-reggers who go through it every year. So there's quite a few. I mean, we've got a free course as well, which loads and loads of people access. I think maybe 1,500 people access. So quite a few last year.
Well, you heard it here. For the 13 or 1,400 pre-reg students out there that hadn't found the PharmacyCPA.com website, there is a free course. This sounds excellent. And please, so, what other resources would you say?
The legislation.gov.uk site, which holds all of the legal requirements for prescriptions and medicines, I think it's really, really useful. And I need a 5th one, don't I? I think blogs, to be honest. I know that's a bit general, but if you look up, GPhC Exam into Blogger, you can have a look at, what other students are writing and updating and things like that. So a bit more general.
Interesting. So we've heard a lot so far about resources and sort of the idea of how long you need to maybe train and prepare for the exam. But I think we now need to cut down to brass tacks. And could you please share with us your thoughts on what is the hardest part of the GPhC pre-registration exam?
I mean, we haven't mentioned it so far, but it's going to be the calculations. You need to pass those calculations by 70%. So you get 20 questions, so you have to get 14 of them right. If you don't get 14 of them right, you're out the door. Even if you got 100% on all of the other parts, you can't pass the exam.
How would you rate it in comparison to, say, GCSE mathematics or A-level mathematics or even degree mathematics?
Well, degree mathematics, I mean, you're not going into exponents and like doing massive algebra and things, but there's certain things in there that are quite tricky. I mean, it's way above GCSE, but it's really from a practical basis. For instance, answer me this, Tom. If you had 2 beakers, one of them had 20% solution, and then I've seen the fear in your eyes now, and 120 mils, and you pour 20 mils of that into something that contains 0.3% and is 100 mils, what is the concentration of the resulting solution?
Well, I actually always thought the beaker was a character from the Muppets, so I wouldn't be able to answer you on that. But yeah, exactly. I mean, for myself, and I have a history in dealing with fairly complex statistics. Off the top of my head, I wouldn't be able to answer that.
And the majority of people do not.
And it's one of those things also where I think often it's learned practice. It's something which often I've certainly found when I've been using mathematics in my line of work, it's often been the case that it's the practice of those formulas on a day-to-day basis, which I imagine is an essential part of pre-registration training, and therefore something which you would learn not just theoretically, but also in terms of on-the-job practice on a regular basis.
Yeah.
So that's interesting, and I suppose, and I don't know if there are many books on pharmacy calculations, but in general, regarding the examination itself, what are the best books?
What I used was, I used a book called It was a green book called Common Symptoms in Pharmacy, which is fantastic. It just kind of gave me the foundation and the basis of, what is a fungal infection, what does it look like, chickenpox in children, things like that, things that every pharmacist should know. But then obviously above that, you need to know about calculations and law. So law, I definitely go for the MEP. For calculations, there's quite a few books there on the on Amazon. If you type in pharmacy calculations, a lot of them are kind of American, based around technicians and things. I'd go for proprietary UK GPhC registration exam book. We publish some via PharmacyCPA, but calculations wise, Pharmaceutical Press is quite good as well. Maybe it teaches you a little bit more than you should know, but more is better than less.